Welcome, everyone, to our second dialogue forum for the Community of Practice designed to advance supply chain resilience in Canadian health systems. I am absolutely thrilled to have you join us and spend your time, bring your expertise and perspectives to this event today. And we are just thrilled to have a number of very impressive speakers and panel members join us. So to get underway and acknowledge everyone's important time, let's go to our next slide. And for those of you who don't know me, my name is Ann Snowden. Some of us may or may not have met. I'm the Scientific Director and CEO of SCAN Health, and am leading this community of practice, which actually follows on a program of research that was prior funded by CIHR to understand and really examine where is Canada's supply chain capacity, ability to respond to challenges such as those we've all been through on this pandemic. So today we're going to bring forward a very important dialogue on focused, if you can go to my next slide, focused on how do we advance supply chain and resilience in Canada. And why is that so important? It's important first and foremost for every Canadian health and wellness. For Canadians, if you don't have access to the care services you need, you don't have access to the products that are needed for that care, whether it's a prescription you need or it's a hospital service of some kind, supply chain is at the center point of really Canadian health system's ability to deliver care, and the resilience of that supply chain becomes front and center, very, very important. So without any further ado, let me start with our land acknowledgement. Where I am seated today, I certainly acknowledge many of you are seated in different parts of the country, but I'm located at the University of Windsor, which sits on the traditional territory of the Three Fires Confederacy of First Nations, which includes the Ojibwa, the Odawa, and the Potawatomi. We very much respect the long-standing relationships with our First Nations people in this place known as the 100-mile Windsor-Essex Peninsula and Straits of Detroit. It is the only place in Canada where the US is actually to our north, which is kind of an interesting part of our geography. Go to my next slide, where I'd like to just give people a background on what we're attempting to do today. We'll start with a very, very interesting panel discussion that brings together three industry leaders, thought leaders, and experts, and how and where and what was our capacity as a country to respond to the pandemic, and how do those lessons learned now take us forward to better advance and strengthen supply chain resilience in the future that benefits every Canadian and most definitely every health system. Then we'll take a very brief break just to allow our next panel to assemble, which will be three of our 6 work group leaders that are advancing and building that co-design strategy for advancing and strengthening supply chain resilience. Dr. Kathleen McMillan will be with us, who is leading the workforce work group. Jay Myers, Ron Johnson are leading the domestic supplier work group, and JP Prasad, who leads the sourcing and procurement work group. I will be facilitating, and I also lead the leadership and policy work group. We'll then follow that discussion with a brief break, and then it's the opportunity for all of you to join us in those breakout rooms you'll see listed here. And we've assigned you, and we will actually take you to that room automatically. You don't have to do anything on your computer, so that we can gain your insights and perspectives on the priorities and co-design solution challenges that we need to proceed with as this supply chain network advances to year 2 in our 5-year program of work to co-design the solutions Canada needs to have a much more resilient supply chain. And we will finish by 4 o'clock today. So that gives you an overall sense of our agenda. And for those of you, if you can go to my next slide, what I'd really like to highlight is what are we hoping to achieve today in this dialogue forum. As I've mentioned, it's the second of since the Scan Health was funded for this community of practice. We're hoping to achieve three things. One is validate and finalize our work group priorities. Finalize is, I use that carefully. Validate where we think our co-design and solution focus should begin heading into year two. Of course, this is a very dynamic and changing world in terms of supply chain. All of us continue to experience disruptions, not just in healthcare, but of course, many others. So we really want to get your insights, your ideas, and your thinking to be sure we are identifying the most critical priorities that the community of practice work groups will move forward on as we proceed into our year two of this initiative. The second thing we'd really like your insights on, and you'll be sharing this with our work group leaders in the breakout sessions, and that is making sure that those priorities have very clearly defined outcomes, impact and value. And impact and value for whom? Every Canadian, of course, but also Canada's health workforce, which we absolutely need to have front and center to ensure they have the support they need to deliver the incredibly important care. And we are able to map to and leverage many different strengths, expertise, and capacity, whether it's in the publicly funded health systems, it's with our private sector partners, and or with many other organizations that are driving and supporting and enabling healthcare systems to deliver the strategies Canadians need. The third thing we hope to achieve today, and that's primarily why we've built these breakout sessions as we have, is to find the synergies across the work groups. Each work group will be driving towards key priorities, which I'll share in a moment. But we also are very mindful that many of these important priorities cross over other priorities. And how do we make sure we achieve the most efficient and effective work solutions to drive supply chain resilience across the country? Let me, for those again who may or may not be aware, identify what are the work groups I'm referencing, and what are some of the areas. Oh, sorry, I'll go to my next slide. It's moving a little more slowly on my screen, perhaps yours too. The overarching goals of the community of practice, and this is what we've set out to achieve and what we're funded to achieve as our mandate, is first and foremost, advance supply chain resilience across our Canadian health systems and sectors to strengthen post-pandemic recovery in Canada. We'll talk a lot about that over the course of today. Secondly, and just as importantly, I might add, is to strengthen, enable, and support our health workforce so that we have a health workforce working in environments that are supportive and help them to deliver the best quality and safe care possible. And then thirdly is to co-design with all of the expertise around the table, implement and eventually scale new strategies and solutions to overcome the challenges we saw in supply chain over the pandemic and to advance supply chain resilience more broadly. Next slide. To touch on, I think, is our work groups. Nope, those are our outcomes. The outcomes for overall in terms of the community of practice, not just for today, but keeping these in mind front and center as we build our dialogue, our discussions, our panel discussions today, is to advance and create resilience and create a very resilient future for Canadian health systems. Sustainability. Canada has a long history of experiencing and responding to challenging events. COVID was one of them, SARS, H1N1, many others in the past. But how do we learn from that and sustain and build it into the DNA of our health system so that we never find ourselves in those positions again in future? And thirdly, which is probably one of the most critical ones that continues to emerge and was front and center during the pandemic and will continue to be, in my opinion, and that's equity. How do we make sure every person has the opportunity to access the care, the protection they need to support their health and wellness, rather than prioritizing, this group gets it and that group we're not sure perhaps does. So equity will be a theme embedded in virtually every solution, every strategy we advance in this community of practice in order to fundamentally achieve a much more resilient supply chain for our health systems in future. To give you a snapshot of our progress so far, we've spent the first year of this community of practice assembling and building the necessary partnerships that we know are going to be needed to be successful in meeting our goals. They are organized into what we're calling work groups, and the work groups you see here are listed with just a very, very brief description of the priority areas those work group partners have identified as being the first place to begin to design solutions to advance the community of practice goals. So sourcing and procurement, collaborative stockpile management have designed a priority to look at how do we build multi-jurisdiction coordination to much more effectively manage supply chain infrastructure and logistics. Just one quick example, as this pandemic unfolded, every organization in many cases, and for sure every province and territory, was competing with each other to find those products in scarce supply, given the shutdown of many of the sources in China and Southeast Asia. That group is going to prioritize how do we work together? We're a very small part of the global market, and we can't afford to compete with each other while also competing globally. Leadership and policy is the one that I am leading, and that is in some ways a little bit similar to sourcing and procurement. How do we build a multi-jurisdiction engagement strategy? How can leaders work with leaders across our various provinces and jurisdictions? How do we build in ethical frameworks for decision making so when you don't have enough critical products needed, you use an ethical framework to decide who are the populations at greatest risk, and then you prioritize allocation to the greatest risk populations in order to establish equity. Digital supply chain is a third work group, and that is how do we much better design a digitally enabled supply chain? If we don't know what critical supplies we have and where they're located and how they can be allocated equitably, that all depends on a digital infrastructure, which during this pandemic just simply did not exist. In many provinces, we had people counting masks or things on hand. So digitally enable our supply chain will go a long way to advancing supply resilience. Domestic supplier network is a fourth working group, which really asks the critical questions. Where and how can Canada be self-sufficient? How can we resource or build on our expertise in manufacturing of products and rely on our Canadian-based companies so that we are not having to compete for absolutely everything globally? And workforce sustainability. There is no question in the data and the research we've conducted over the last year and a half that the health and wellness and confidence of our workforce is directly influenced by the capacity of supply chain teams to make sure they are confident in the quality and safety of their work environments. So that work group is really taking on where and how can we rebuild that confidence in our workforce? How can supply chain teams work closely with our workforce leaders to ensure they have what they need and they're confident in being able to deliver quality and safe care? Our last work group is supply chain security and sustainability. How do we make absolutely sure that when the next threat or challenge or disruption takes place, that we have security in our supply chain? We can mobilize across the multiple and different supply chain capacity and leverage to make sure that we can overcome, proactively manage any vulnerabilities we might have to ensure every Canadian has access to the protective supplies, equipment, and or health services they might need. One of the most I'd say unique distinctions of this community practice is our citizen forum. We learned in the pandemic, and we worked very closely with the Imagine Citizens group on the role of citizens in being part of solutions. The last thing we want to do is design supply resilience strategies that will undoubtedly impact our Canadian population, but not have them at the table to help make sure that those solutions and those strategies actually designed for people engage the people they are designed for. So the Citizens Forum is a group of citizens who participate in all of those previous 6 work groups, bring their unique perspective and lens to the solutions and the co-design of solutions so that we can be very sure that they achieve what they are designed to achieve front and center for the health, wellness of Canadians. So that's a backdrop in terms of our work group and citizen forum that really is the engine of this community of practice in taking on the very significant challenge of co-designing those solutions that will in fact drive forward on supply chain resilience and build a future supply chain resilience that is able to be very agile and responsive and have the capacity to support and enable health systems to deliver the care they are so well established to deliver to those who need it when they need it, and absolutely ensure that it happens in a very equitable and ethical approach to create that new future, if you will. So with that background, I'll go to the next slide and kick off this dialogue forum. There we go. The slides move a little bit slowly, so there we go. It is my absolute pleasure and honor that we have been so fortunate to have the expertise and the perspectives of 3 very experienced thought leaders and experts in this whole area of supply chain resilience and advancing Canada's future. We are joined today by Erica Dalio. She's the Vice President of Pharmaceutical Partnerships at Shoppers Drug Mart. Dimitri Polygenis, who is the President of Pharmaceutical Solutions and Specialty Health in McKesson, Canada. And Rick Prinzen, who is the Chief Supply Chain Officer and Vice President for Donor Relations for Canadian Blood Services. So Dimitri, Erica, and Rick, so thrilled to have you join us today. And the panel this panel is going to take on that critical question: how do we break the barriers to broker public and private sector partnerships? How can we learn from where our experience of those past 3 years, 2 to 3 years, and really achieve and drive the future? So I will just ask our panel members to join me on screen, and maybe they already are. Just double check. There we are. There's Rick, and I think I saw Dimitri and Erica, and we will get underway with beginning really with an opening first question for our panel members to respond to. I think for many health system organizations, even government leaders, and the many partners we have on the call today, it's exceptionally important we understand and get a sense of what were the experiences in that private sector that responded very quickly and worked as closely as they possibly could to respond to the many challenges of COVID-19. So perhaps if I can, I'd like to start with Dimitri. If you would share with us your experiences on what were some of the key lessons learned perhaps, and areas where from your lens and McKesson's experience, this community of practice really needs to consider as we move forward in advancing and designing solutions to advance and strengthen supply chain resilience. So Dimitri, if I can ask you to kick off, and then we will get our panel discussion underway.
Great, Anne, thank you. And it's really a pleasure to be with everyone today, and wish everyone a good afternoon for the conference. So, I'll start maybe pretty broad. I mean, there's a lot of things as I look back where I think we can feel proud of how we mobilized, as Canadians, I think through the challenges we faced. But there were certainly areas of opportunity, and I would maybe broadly say that there was very quick and fast collaboration amongst a lot of the stakeholders involved in the supply chain. We realized, I think, and maybe for some it was a well-kept secret of how much work goes into ensuring that our supply chain stays stable. And I think the pandemic and a lot of the challenges around that, I think, uncovered some of those sort of more vulnerable areas, and we encountered some challenges, which I think in the collaboration with retailers and manufacturers and the various suppliers, I think we were able to do a good job navigating through. I think where we started to encounter challenges, I think, is we didn't have a lot of systems to access information, and certainly as it relates to kind of the public-private dialogue that started. I don't think we had regular forum, and that I think that muscle of regular dialogue between a lot of the stakeholders on the private with provincial and federal counterparts, I think wasn't there, and our ability to have a common data pool for us to be able to make decisions wasn't there. And I think those were, the biggest areas of opportunity as I kind of think back. But maybe I'll stop there and see if others want to comment and can continue that kind of dialogue.
So much, Dimitri, you've identified some really significant areas, like how do we know what the other person or group or teams, et cetera, are doing? So absolutely. Erica, let me ask you now to weigh in from your perspective and the experience of Shoppers Drug Mart, which played a number of important roles to sort of jump into our discussion on what were some of those challenges and where now might we take those challenges and translate them into opportunities.
Apologies, Anne and Dimitri. I heard bits of what you're saying, so I'm hoping I'm coming through clear.
No problem.
I had to access the Zoom through the web browser. Can you hear me?
Yep, we can.
Great.
We can hear you.
I think from our perspective, there's a number of elements that are increasing the fragility of our supply chain in Canada, and we saw that quite apparently through the pandemic, and Dimitri covered a number of them, both from a local and national level. As I reflect,
and technology is always something you can't control. No question. So we will see if Erica can come back in. And Rick, maybe while we're waiting for Erica to reestablish, let me go to you, Rick Prinzen from Canadian Blood Services. You are one of those pan-Canadian organizations that are the only source and delivery model for blood products to literally every organization. Where would you see the major opportunities for lessons learned here and areas of fragility that we could possibly improve on or to strengthen?
Yeah, thanks, Anne, and welcome and delighted to be here. So welcome to all on the call. Yeah, one of the things, for us, when we talk about resiliency, one of the things that we were able to leverage was the pan-Canadian relationship that we have with multiple stakeholders. And by that, I mean, an example would be you have relationships with your ecosystem, and we were able to leverage what we call the National Emergency Blood Management Committee, which is it's a pan-Canadian enterprise consisting of health officials, transfusion directors in hospitals. So it's got the hospitals and it's got CBS. And so you can manage a total system crisis, if you will, by bringing together people that can make the right decisions about what needs to happen in different pockets of the healthcare system. And so I think the point really for me is to say that the learning is that that's not, we leverage that today for numerous different conditions, but certainly in a pandemic, you can imagine that it becomes even more important. And so I think that notion of building relationships that are on a pan-Canadian level, and Dimitri made this point, you've also got to be able to share data so that you know approximately what's happening in different segments and how the system needs to respond. So that's one really important thing. And of course, the other element of that is with those relationships, you've got team enablement and trust, and because there's going to be some big asks, and you need people to respond. And we could see how critically important that was during the pandemic. The other thing is that the cycle of renewal it can sometimes be a little bit slow depending on what sector you're in. And not so much having spent time in the private sector and now being part of a publicly funded organization, you can imagine that the cycle of renewal perhaps needs to be a little bit more agile. And we had been working for a number of years on developing that agility in terms of the cycle of renewal. And when I say that, I mean plan, do, study, act, et cetera, respond. So we were in the fortunate position of having built a little bit more agility around that as compared to what it might have looked like 10 years ago. Another key element is it sounds a little bit simplistic, but when you've got a real strong focus on continuous improvement, you build an organizational capacity and capability to absorb change quickly. And you do it, even though you might think like continuous improvement can be on a very micro scale, very small increments. But when you work that muscle day in and day out, when there's a large scale change, the organization is in a better position to absorb that. So that was one of the key learnings for us. And we've been focused on that for quite a long time now. And maybe the last point I would make is to say that, well, I'll preface this by saying we've got a really strong working relationship with the Canadian Armed Forces. And when you think about that particular relationship and the ability to respond in emergency conditions and to perhaps even bring new products to market very quickly, that kind of a relationship, again, builds the ability for us to respond. So we did that, for instance, with the work that we did with convalescent plasma in the early days of the pandemic. How could we organizationally respond? But we're also doing that with the Canadian Armed Forces and things such as leukoreduced cold stored whole blood, freeze-dried plasma, these things that are needed in emergency conditions, and being able to bring products to market very rapidly. That's also a condition that I would offer is necessary for these types of situations that might take us a bit by surprise.
Thank you so much, Rick. I think you raised a couple of really critical issues, and one being those relationships really matter. And given Canadian Blood Services does deliver blood products for every jurisdiction, those existing relationships you had sounds like it served you exceptionally well. And even relationships across sectors, meaning military is a group that often doesn't cross over health system care delivery, or not as often. So those relationships and those processes or continuous improvement strategies were a critical strength. It sounds like you drew upon. Erica, thank you. Apologies for the technology challenges. Let's come back to you to share your perspective on what were some of these key elements that contributed to fragility that you would say we really need to pay attention to in this community of practice.
Fantastic, and thank you and everyone for your patience, and thanks for inviting me here today. I've enjoyed the dialogue thus far. So I think since I've missed a little bit from my colleagues, both Dimitri and Rick, I'll take a moment just to summarize my perspective. And so there are a number of elements that are increasing our fragility of our supply chain within Canada. And so both Dimitri and Rick covered a number of them, both local and a national level. And as I reflect on our experiences through the pandemic and what is the biggest opportunity to advance equitable health outcomes for Canadians, the biggest question I have, and both Dimitri and Rick mentioned it as well, is do we have the right data sharing infrastructure between the private and public sector to assess the threats on our healthcare supply chain? And so why that's such an important question, and you also alluded to it in your intro, is on a global scale, Canada represents 2% of the market share for drugs globally. And so it's really hard to react and recover from the threats when you hold such little market share globally, and all these products and healthcare products are demanded globally. And so to a global manufacturer, we have an attractive market by size, by unique packaging requirements. We require health, English and French, and ultimately by reimbursement price. So those things really stick out to me. And as a country, we're tasked with looking at measures, processes, the tools to really ensure we have a resilient supply chain along the end-to-end supply chain. And I know we talk about threats end-to-end, and I'm taking a little bit of a global perspective when I answer your question here. And there are threats along the way, and each threat poses an opportunity. And so we should acknowledge a number of factors, one being economic factors. I hear you, Anne, but am I not coming through?
Yes, you're absolutely coming through. Thank you.
Oh, fantastic. Okay, I'll keep going. I'll just turn my computer video off. It might help. So we should acknowledge.
Yes, thank you.
We should acknowledge economic factors, so pricing and regulatory issues that perhaps lack federal and provincial coordination. And so PMPRB, proposed guidelines to target excessive drug pricing in Canada. The risk here, global companies, when supply is challenged, and I'm speaking specifically when supply is challenged and what we saw through the pandemic, they will prioritize more profitable countries. And so if we focus on trade and distribution as a factor as well, there are opportunity amongst private and public sectors to leverage efficiencies to get product to patients faster. And so an additional example of that is COVID vaccine. So every province is different, but what we saw was vaccines were procured at the federal level, stored at the federal distribution sites, passed down to the provincial distributor, and then finally contracted distributor. So really not drawing on the economies of scale across our country to get vaccines to patients as quickly as possible. So that was a major learning for us as an organization as well. And if I think about trade, economy, leveraging that, there's an opportunity, and you mentioned this in earlier as well, to consolidate our buying powers and to increase our ability to obtain foreign supply. And so consolidating those buying powers across public and private sector. And so over the pandemic, influenza vaccine, rapid antigen tests, children's acetaminophen, we were all procuring independently. So it's finding that right balance between competition with mitigating drug shortages or our ability to secure adequate supply. And it's all towards that goal of equitable care. So striking the right balance is a lesson learned for sure. I think the threats will always exist, of course, across to our supply chain. It's really about how do we react to the threats with speed, agility, and timing. And I think that's really through data sharing. And so the collection of data exists today, for sure. And Health Canada we do a great job with Health Canada. However, the way in which we move the data across the sectors and the supply chains, both private and public sector, is an opportunity. And currently, my perspective and opinion is that we have a very limited feedback loop. So we're losing the opportunity for all sectors to collaborate on analyzing the trends and themes that we see within the data. And so ultimately losing the opportunity to drive visibility and solutions. And one example of that would be optimizing our drug reserves. We've talked about it. My question is it really data driven once we expand over to the private sector? And as a community, we've talked through that. Ultimately, I think if we expand our reporting requirements, advance analytics and forecasting across the sectors, expand disease and virus modeling and share, ultimately increase the transparency of our data on these pieces, I think it's going to lead us down a successful path in the future.
Thank you so much, Erica. You raised a number of key pieces that actually tied back to Dimitri, what you've shared. You mentioned there was no forum for sharing information or data, quite frankly, that made it very challenging for all of the many teams and agencies and organizations, struggling to respond to this pandemic. And Erica specifically, data sharing, what reserves do we have? Where are they, for example? And Rick, I think you identified even the same. In order to understand where your greatest risks are, you've got to have line of sight to that information or that data that's so important to inform decisions. So let me go back to you, Dimitri, for a moment. If you had the magic wand on data sharing, information sharing, either or both, because they are linked, what would you advise or what would you suggest this community of partners should really be prioritizing in that space? Is it specific types of data? Is it specific platforms, for example, to share information or data per se? What would you advise the community of practice to say, boy, if you're going to achieve one thing, this is one or two of the best options that we could really benefit from?
It's a great question, and I mean, before I answer it, I'll just preface it as I'm gonna probably approach it from a very supply chain focus. So I think when we talk about data, I mean it's very a wide spectrum of opportunity. But you know, from my lens in my world, I think what do we need to know? And Erica started to touch a little bit of that. We need to identify what is a critical resource when we look at healthcare. And this could be drugs, it could be devices, it could be diagnostics, it could be PPE. I mean, what do we need to ensure we have a critical supply of or availability? So, and what is the list of things that we want to make sure that we never run out of? Number one. Number two is how much of that product is coming into the country? Where is it at any point in time, and how is it being consumed? And those are all three things that we had to very manually try to piece together as we fought through the various challenges. It started, I think, during the pandemic, but still continue today when we look at shortages in pediatric anti-infectives and acetaminophen and nitroglycerin and infant formula. I mean, it seems that it's every day it's something new, and we still yet don't have a very automated way of saying, okay, how much do we need? Are we able to bring it in? And Erica mentioned it. We're all sourcing and procuring these products for different purposes, different markets, different customers, and we don't. And there is the technology and automation to say, here's a product coming in. We can scan it. We can upload that information and say at any point in time we know how much, for example, nitroglycerin spray there is in the country and who is drawing on that. I would say one of the biggest challenges we had during the pandemic was trying to determine, back to your initial equity point, is who should get what. Everybody wanted to proactively prepare. And in some cases, it verged on hoarding. In other cases, it was, again, proactive inventory management. But at the end of the day, we had hospitals, we had pharmacies, we had clinics, everyone competing for similar products without any clear understanding of who's driving that demand or consumption. And we saw that the pandemic showed that our people moved around. People left urban centers. They went out into rural communities. Pharmacies in cottage country were busier than those in the cities. And we saw, and there was no way for us to keep up with that ability to react, I think, to those needs. So for me, I think what's coming in, where is it, what's going out, and ultimately, how do we build some predictive analytics or artificial intelligence around what we will need going forward, given the current demand? I think that really is the piece, and the technology exists. This is not something that has to be developed. But in order to overlay that technology, we need to be able to bring this information together. And now we're doing it in a very, very manual way. I mean, we have a great dialogue with with Health Canada, with a lot of the provinces, where weekly we're talking about some of these critical shortages, but we're literally sharing Excel spreadsheets. I mean, there has to be a better way. There has to be some maturity around this that we can bring forward. So, you know, as I think of ultimately what the 3-step plan is here from our learnings, it's, you know, let's make sure we have the right infrastructure for dialogue. Let's make sure we have the right infrastructure for data, and let's make sure we have the right infrastructure to enable partnerships to occur quickly. I mean, it's easy to say that public and private have to work together, but that's not a simple challenge for us to solve. And I think it depends on us putting an emphasis on those 3 things. And I think we're probably doing okay on step 1. I think we just need to now move to step 2 and step 3.
So Dimitri, you've covered some really important ground there, and I know many dimensions that you've identified have come up in the various work groups. That critical product list, what is most fundamental that no health system, for example, or team can go without? And I think you're right, there are some very important, there's more important work going on in that space, which you identify. The automation, where and how can all of the critical players and stakeholders actually really engage so that they have access to that, which then removes some of the competition that that all of you actually have referenced. Let me perhaps go to Rick on this one. You have established relationships. Can you share with us a little bit, in response to Dimitri's 3-step plan or processes, where and how could we be much more automated, systematic, and engaged across jurisdictions? Because that, at the end of the day, assuming you can share data, and we'll get to that in a moment perhaps, it's you, as you point out, it's those relationships, it's the existing forum, if you will, to work together to solve a shortage, as opposed to just share with, okay, we have this and we have that. Maybe you could sort of weigh in a little bit in your experiences, multi-jurisdictions, what you see as really a critical feature in bringing this collaboration, coordination effort forward.
Yeah, thanks, Anne. So I hope this addresses the question, but I want to expand a little bit on what Dimitri said as well, which is to say, in our particular, the Canadian Blood Services lens is that we connect a donor with a patient. So our mission statement is we are Canada's biological lifeline. So everything that we do connects a donor with a patient. Now, if you could imagine, in the ideal condition, we would see a future state where we could relate the donation with the patient outcome. We could literally see how effective the health outcomes were, and you can apply that to other products as well that are in the system that literally say, when a patient has this particular need and he has this particular experience and it comes from this source, this is the actual outcome, and that can help us manage utilization. It can be targeted. We've all heard about specialized medicine. In our particular instance, an example would be that today we are underrepresented in certain communities as it relates to the donor base. So sickle cell disease, as an example, our donor pool is underrepresented in those that would serve the sickle cell disease patient cohort. And that's what I mean by saying you connect inputs with outcomes, health outcomes. And then as a consequence, you can create an optimized healthcare system. And so that, I think, is perhaps a bit of my view. That is perhaps a bit of an ideal end state that we might seek to achieve. And you would do that by sharing data. I think as well, we have to think about new ways to approach that. So for instance, we would not imagine that we need to be connected with all of the laboratory information systems across the entire country, because that's going to be extremely, extremely expensive. So what's a different approach that we could apply that respects all the privacy considerations, everything else could be used to inform research, but that end-to-end connection of data, I think if we as a country could solve that would be absolutely immensely powerful in terms of both patient outcomes and overall healthcare system costs. Yeah, is that where you wanted to take that, Anne, or is anything else I need to expand on?
Yes, thank you so much. It may just be me. My apologies, Rick. It may be that I'm missing a couple of, it cuts out a little bit on my end, but that might be me. So I just wanted to double check one thing. You mentioned extremely expensive. I think what you were saying, but you just cut out enough so that I'm not sure. connecting actual systems could be very expensive. We need to find new ways to make sure that data is accessible to all those who need it. But can I just clarify if that was what you were referencing, just so that everyone can hear the same messaging?
Yeah, I would imagine, and I don't know, because I'm not an IT expert necessarily. I use, of course, myself, my team, we leverage IT systems for overall supply chain performance. But you can imagine that if you're trying to connect multiple people across multiple domains with tons of different systems, that could be very expensive to try and make that happen, to get end-to-end connection. So what's a different way to think about a solution around that? And I think you and I exchanged the leveraging of technology such as blockchain as an example that
Yes,
that could be a little bit different. That might be a possibility. Yeah.
Just want to make sure I'm not cutting you off, Rick. Sorry. Thank you, Rick. And I apologize because it may be me that I was just cutting out a few things, but I think what we've talked about, and you're so right here, there are multiple and different and unique legacy data, infrastructure systems, technologies, software, all those things. And as Dimitri quite accurately points out, the technology is not the problem. What we're really getting at here is the connectivity needs to be in place, and finding those innovative ways that don't go through the painstaking of how do I connect that lab system to this pharmacy over here with that province, etc. But what are those technology solutions out there, including predictive analytics tools like AI, that should be contemplated, and to achieve what and for whom? So let me go back to one item with Dimitri and Erica. We talk a lot about data sharing. And if you were to say and direct the community practice on that question of data sharing, where would you start? What data would you start with being most critical? I'm guessing maybe it could be product data, but I might be wrong on that. And I don't, and I think that's probably well worth considering. So perhaps, Erica, I could see you. What data, if you had a magic wand again, if you could, if absolutely every data holder was able to share it, what data would you say is so critical, at least as a starting point?
I think, and not just for the past 3 years, I think as we move forward, demand signaling. So increasing the demand signals and sharing the demand signals across the sector throughout the supply chain would better increase our ability to predict. And so why that's so important is there continues to be vulnerability across therapeutic groups. So our ability to identify proactively and recommend alternative pathways would really help. We're not so reliant on our 2% market share. If we have a better understanding as to the demand signals coming through, for example, we see it still through the pandemic and still today, the bronchial therapeutic class. The top 2 products that we use in Canada represent more than 50% of the share. So 50% of the dispenses on those 2 products. And at any given time, if there are challenges within those 2 products, the next products, number 3 to 8, couldn't possibly absorb the volume that would be shifting from product 1 and 2 to products 3 and 8, even combined. So if I had a magic wand, it would really be about, and we're seeing the same through amoxicillins in the anti-infective category today still. So a magic wand for me would be visibility and sharing of demand signaling so we can improve our predictive analysis and forecasting.
Fantastic. So demand sharing, the item I think you're bringing forward, which is one of the things during the pandemic, was just so challenging to get our hands on, literally on every jurisdiction. How, I guess, demand sharing by product category, by inventory being held at different and multiple jurisdictions. Erica, you may have already said that because some of my technology on my side is cutting out a little bit. But is that, have I got that right? It's that utilization, what are the demands? Where are the demands highest? that data starts to inform leaders both on the public side and the private, military, all the different supply chain areas that now become so important. Have I got that right?
Absolutely, completely. And it's not just to resolve the immediate situation, but to better position us for future forecasting. And amoxicillin continues to be a great example of that. We saw such spikes in demand, 200 to 300%. But when we look to both our local manufacturers and global manufacturers, without that expanded disease and virus modeling as well, we had a really challenging time to get the forecasting down right with mitigating risk to the supply chain.
Yeah, and if I could build on that just for a moment, because I think Erica's touched on a very important
please join
point.
in, Rick.
Yeah, Erica's touched on it. Yeah, she's touched on a very important point here, which is our experience as well was we were getting the best information we could from people that were really trying to assist in understanding what that demand signal would look like. But you can imagine, we would have all experienced how different health authorities were responding and coming out of the pandemic or not, with different procedures in hospitals or not. And so the information was very much anecdotal. And so that really clean demand signal was just, we did the best and we did it collectively based on the relationships that we had. But you could imagine it'd be a lot easier to do if you had a really clean demand signal that was dialed into what was going on in different elements of the system.
Maybe I'll add to that. So I think, we're unanimous that demand is where, ideally where we'd want to start. For me, though, the bookends here are demand and availability. And I think if we were a larger nation with more people, perhaps availability would be less of a priority. But given we don't have our pick, I think, of inventories and aren't the priority, as Erica kind of kicked off with, we're only 2% of sort of the global demand. Making sure that availability is there is key. So for me, I think it's demand, availability, and then some alignment around what's critical. And because I think if we had a good idea of those three sort of vectors, then we can start better identifying, okay, where are we vulnerable? Where are there products that only have one manufacturer, and do we need to encourage a more redundancy? I mean, certainly blood is a great example of that, where we're sort of limited as well. But I see too often we look at pediatric anti-infectives and amoxicillin. I mean, we got caught in something that was, I would say, of our own making, in the sense that we were so good at staying indoors that the infection rate with children went down dramatically. And then, of course, people weren't indoors anymore, and those manufacturers who had to throw out or write off all that medication that nobody consumed, then decreased their supply, their manufacturing ability. And so we got caught in a bit of a boomerang situation where we didn't have enough manufacturers that could generate the type of product we needed in the time we needed it. So that, to me, I think really is a symptom of not being coordinated. And maybe if I can just go touch back on the technology and cost, certainly if we want to create something new, it's going to be hard to justify and get everybody to fund it. But I think we have enough standards out there that I think are broadly adopted, that I think if we can just accelerate or put more coordination around, I think could get us really a long way there. I mean, I'll use one example, because I know certainly with Erica's organization, we've talked is just, how do we push barcoding and so forth? Because if we're doing that for our day-to-day, then it's very easy to export that information or consolidate it. And data is a very proprietary and sensitive conversation. But I think if we consolidate demand and availability, I think most people would agree that they don't have a problem sharing that information and ensuring that we, as Canadians, have a very, very good visibility on what the health of our, critical product list is, which again could include drugs, could include blood, plasma, could include devices, could include gowns, masks, whatever we feel is necessary, I think, for in these times of crisis.
Dimitri, I apologize. I don't want to jump in. I want to just make sure I'm capturing some of the key pieces because they're so critical here. The bookends, as you describe it, what's the demand? And that was something in all of the research we did, of course, in all the provinces, there was very limited data on the shifting sands, if you will, of demand, high then low, depending on where we were in the pandemic versus the availability. The demand data is very much typically in the health system side of the health and data infrastructure, if you will, not to oversimplify. And the availability data is where the manufacturing, distribution, private sector side. So I think what you're saying is don't reinvent any wheels. Don't make it hard. Use the data or use the infrastructure we have, the barcode capture of products in terms of what we have, where we have it. And then, but the goal here, or the opportunity from what I can sort of put together with some of the technology challenges I'm having, is bring that connectivity together so that data now allows for those much more effective technologies that could even imagine predicting risk of shortages. Yes, the demand is starting to emerge here. We expect it to continue there, and mapping it to availability data on hand. Now that starts to create a very data-driven and informed environment for supply chain teams to be much more agile and resilient. Did I capture that, and did I miss some of these pieces that you've also generously shared with us today?
No, I think you captured it, and I just want to maybe reiterate that, with data, you also need dialogue. And
if you were to advance supply, sorry, go ahead. I apologize. I didn't mean to overstep. Dimitri, I'll stop. Yeah.
No worries on it. There's a delay, I think, and so no problem. I was mentioning that I think dialogue needs to support that.
Yes.
that data sharing, because one kind of anecdote that we encountered during the pandemic is I mean, we service in our business 9,000 pharmacies and 800 hospitals, and we know at any period of time what a particular store is going to need for their patients. What we don't know is what changes in the environment cause them to change those demand signals. And we found ourselves in a very precarious situation as it related to inhalers, for example, during the first start of the pandemic, because nobody wanted to use nebulizers in hospitals. And then you had, a huge hospital community across the country wanting to now use community a manufactured product. And those are that's where kind of the dialogue needs to, I think, add to the data, because we could have never really seen that coming unless we were talking. So data has its limits and needs to be, I think, underpinned with solid dialogue, I think, with the various stakeholders.
I would agree, Dimitri. I'll just add a couple comments while we wait for Anne, but it's really about the data is one thing, but it's that feedback loop that I referenced earlier, and that collaboration on the trends and themes we're seeing. Because as Canada, we could say it again, but not to belabor the point, as small of a market we are globally, timing, we need to react quickly to be able to come out of it on the other end successfully.
The other thing that I would add is there's an element of where do we want to place our bets as it relates to self-sufficiency, and because we're to your point earlier, Erica, we're very dependent on international sources. Yeah, we're very dependent on international sources. Now, some of these things are going to be within our control, some not. But I really do think that there would be an opportunity based on a risk-based decision type of model. Look at where do we want to increase our self-sufficiency, in what capacity, Certainly vaccine production would have been kind of over the last 3 years at the top of that list. I shared with some of you previously that the IG self-sufficiency, we're 80% dependent on the U.S. market for IG, and we know that 50% of those products are life and death conditions. So you could imagine that if there was a shortage and you didn't have access, it would be devastating to the Canadian patients. So where do we want to be? Where do we need to increase self-sufficiency? And it's not been a terribly attractive market to invest in. When I was in the private sector, we used to talk about, we seemed like we were justifying our existence in Canada every 2 years as a manufacturing operation. So we need to think about that in the context of what we've experienced over the last 3 years. Can't do it all, but let's use some risk-based decision-making models, and let's place some bets accordingly as to where we need to invest. And by the way, I would also offer, I think that Canada is likely to be one of the richest country in terms of labor skills in this particular sector, in the healthcare sector. I think I don't have data to support that, but just based on my own personal experience, I think we've got a rich pool of highly skilled individuals. May not have been born in Canada, but they've come here, and we could tap into that more effectively than perhaps we have.
Just on your comment around sustainability within country, Rick, I agree. And right now we're seeing about 12% of those pharmaceuticals, if I just look at drugs specifically, made in Canada. And we've also seen grants come through to generic manufacturers, both and vaccine manufacturers for new facilities. I think what we need to continue to keep at the top of our mind and reflect on as we go through this, are they scalable to address national issues if and when this does expand again? So that we need to reflect on that as we continue to move in that direction as well.
Yeah.
Thank you so much, Rick and Derek. Rick, you identify self-sufficiency as being really important. That's obviously in very specific and key areas. And I want to map that back to one of the comments and questions we had on our chat is there an opportunity here on that demand side, of course, or for sure, for Canada's health workforce to be able to somehow engage and signal demands. We've certainly seen that in very early phases of lots of public health challenges. COVID was one, SARS was another, where the early signals came from the workforce, who are suddenly using a lot of masks much faster than they had in the previous several years. Is there, and I just throw this out, an interesting opportunity here where we have a health workforce that's seeing the patterns of patients' challenges or health issues coming through the door. Are there ways where we could engage and connect those demand signals, if you will, to add to that data or that information that we already have in hand, but perhaps not as well connected? Are there any thoughts on that for the panel? Is that an opportunity? Something I hadn't thought about.
For sure. I think there are a lot of areas where we can invest in more demand signaling. And I'm also seeing in the chat, Barry had mentioned something about, sorry, maybe not Barry, somebody previous to that mentioned about best practices in wholesale. And, I think again, demand signaling is just, we can get there, but then there has to be somebody that's actively assessing and analyzing those demand signals. And I would tell you, without getting into details, there are a lot of things that we communicate in our business that nobody's really looking at. And so I think we can be collecting and communicating it, but then who's ultimately responsible for reviewing those signals and I guess raising the flag or the alarm or sounding the alarm to say that now action is needed. So I think that's probably where we have a bit of a gap. Is it a public responsibility? Is it private responsibility? Is it some kind of joint effort? But who's going to invest in building the infrastructure to be able to interpolate all those demand signals and create some type of action?
I agree, Dimitri, and I think a critical point within that is really about that, based on our framework within Canada and all the provinces and our procurement strategies and distribution, balancing the competition with this mitigation. So once we align on that and a strategy forward, so then you define the roles and responsibilities in terms of how to manage those demand signals that we're seeing, but we have to align to that balance as a country.
No question. I think you raised that, the who and the what and the how, and those are areas where I think the workforce or the work groups actually can now take these concepts, these ideas or these opportunities, and now bring all those stakeholders, which are already at these work group tables, to start to respond to and think about what those answers what those answers might be. I have another question from Lynn, and thank you very much. Let me put this forward to the group. Canada really is only 2% of the world's purchasing power. We're a very small country, large landmass, as we all know. Are there strategies we should be thinking to leverage, specific private sector partners? Lynn throws out, the example of Walmart's purchasing power, not suggesting Walmart is one of them, but are there ways that the Canadian strategy should be thinking about leveraging or improving our buying power? And Erica, you mentioned this a little bit earlier in the discussion. Any thoughts on that from the group?
I'll just recapture what I had mentioned, and maybe it didn't come through, but I think, yes, consolidating buying powers is an opportunity. And I'm not talking about the day-to-day formulary management across the country by province. This is when we see those demand signals early up front and we start to consolidate that buying power. Now I'm talking about within Canada, because the 3 examples I gave earlier were influenza vaccine, rapid antigen tests, and children's acetaminophen within the last year or so. And so we are all procuring independently. So an opportunity just to ban within Canada exists, but I don't know if there's an opportunity beyond our national borders. I don't know if you meant Walmart in the US or Walmart within Canada.
I think it was meant as an example, Erica, but I want to comment on buying power. That's a very double-edged sword, right? So
Yes,
you can consolidate buying power and create a product availability, but it can also boomerang and hurt you when you over rely on one particular source of product, whether it be for financial, lower cost. And I'm only going to scratch this one. I'm not going to dig in too deeply, but when we look, I think Canada is privileged to have a lot of local opportunity and supply and companies that do that. But we also need to ask ourselves, how much are we committed to supporting local manufacturing? Because that will come at a cost. Our local manufacturing is going to be more expensive than alternative options. And so I think there's a gap in the commitment, I would say financially, because I would say most stakeholders, decision makers are looking to bring costs down, not to pay the premium of redundancy or scalability, which is, I think, kind of what the question was trying to get at. So I think that I would say right now we're probably moving in maybe the opposite direction, where I think in our interest to bring down the cost of healthcare, we're limiting our options and abilities, I think, to react. And I will just end with one more comment. I was just so surprised pleasantly at how nimble Canada is. I mean, we saw in the PPE side, I know vaccines is a complex area, I think, to simulate manufacturing, but we saw companies that in the plastics world that were making shields, with 2 weeks notice. So I think we sometimes, underestimate what our capability is, because I think we do have not only the labor that we need, but also I think the experience, I think, to be able to create this type of product to serve our market.
Maybe I'll chime in here and just to pick up on Erica's thought there as well. I think on a national scale,
thank you so much. Yeah, go ahead, Rick.
Yeah, I think on a national scale, obviously we all know that the system is based on a provincial and territorial funding system, and so one might imagine that you could have a little bit of a fragmented approach to some of the buying opportunities. So on a national scale, that would be one. The other interesting opportunity might actually be to consider extending that beyond just our own borders. So the example I would use is that in our particular business, we would look for opportunities to partner with somebody like, let's say, NHSBT in the UK, to say, could we construct, with all the risk considerations that you raised, Dimitri, but could we construct a collaborative to buy blood banks because we're going to have the same process, and so you might imagine that you could selectively identify opportunities where you could even extend the buying power beyond your own national borders. That would be so we take the 2% to something that's 4 or 5% as an example. That might sound like a crazy idea, and maybe it is, but if in the UK they're publicly funded as well, the healthcare system, so you might imagine that there's a lot of similarities more than differences, and so where could you target some opportunities to leverage a larger volume of product to be more secure and quite frankly more efficient.
You raise, I appreciate, Rick, your thoughts. We are 2% of the market today. You can't go from 2% to 50 or 80. So, but moving forward to maybe doubling from 2 to 4%, and looking for strategies that engage multiple jurisdictions, zeroing in on, key products absolutely everyone needs, and then leveraging that to improve buying power or, purchasing larger volumes. Dimitri, completely agree. Now, devil's always in the details when you leverage other partnerships, perhaps, to achieve and to take advantage of buying partner. There's always that double-edged sword that I think you also quite eloquently point out, and it's always be careful what you wish for, in my mind. One very brief final question that I'd like to finish off our session, if you would, and that is, we talk a lot about demand signals, which is really, really critical on that, understanding where the demands are, what the capacity to meet demands are, which is so fundamental. What might be an example of a demand signal? I just want to respond to one of the chat questions that could help, accelerate or give us a good sort of case example of how and where this could be effective. Maybe, Rick, it's a demand signal or alert on a blood product, for example, or maybe it's something else. So maybe you could just give us a sense of an example there, and then we will, unfortunately, we're running out of time. I'll wrap up very quickly and move on in our program. program. But let me open that back up to you, either Rick, Dimitri, Erica, just an example from each of you or one of you, whichever you prefer, of the kind of alerts or signals that could be so much so helpful and advance where we find ourselves right now.
Maybe I'll quickly, and I think I mentioned it earlier, so I'll make it very quick. But I know there are people from Health Canada here in this meeting. I think we're in the right direction. We're having this conversation. To me, the places to start is where do we see demand increasing across the board by X%? I think so I think we need to start with what is our kind of critical list of items or products that we want to make sure that we have a kind of a sustainable supply of. And then when is the demand increasing? And when do we fall below a minimum level? And maybe that minimum level is 3 months of inventory nationally or what have you. And I know we've been making really great, we've made more progress in the last, I would say 6 months than we've had in the last 10 years. And it's really kudos, I think, to people, I think taking this seriously. And I don't think we've answered it yet, but I think we're close to getting there. And once we get that, I think we can build it. We can put the systems in place to support that regular reporting.
Fantastic.
Yeah, I would just say, and perhaps for us in our experience, and this is going to be kind of an imperfect answer, and I know it's much more complicated than this, but even things such as what is happening with, let's say, in the hospital sector with elective surgeries. And which particular surgeries are being prioritized, and what is the typical demand load on a particular hospital for these elective surgeries? That just as a component of the demand signal would be one example of something that maybe we could get a better line of sight into. That's just from our experience. Yeah.
Thank you, Rick. Erica, do you want to close us out on this one?
Sure, thank you. And I echo all of Dimitri's comments about the growth we've seen over the last few years specifically. And if I think about beyond demand and signaling, one expanded opportunity would be to expand our collaboration on disease and virus modeling. And I think specifically to a really challenging time we've had over the last 3 years on influenza vaccine, coupled with COVID virus. It was obsolete 1 year and then ramped up by 200% in terms of dosages the next year. So it's, as a country, it's been really challenging to get our pulse right on it. And so I think if we private and public sectors band together to really understand that disease and virus modeling and expand our resources, I think that would be another successful path that we can continue to explore.
Thank you ever so much. And with that, I will be very mindful of our timing. We have come to a close. And really just to sum up, I think I am ever so grateful, Erica, Dimitri, and Rick, for a phenomenal kickoff to this dialogue forum. That 3-step process, I think Dimitri laid out so beautifully. What are those critical products we need? Where are they? How then are they consumed? Those parameters between where are the demands, how quickly do they change, and where do they change, and for what products. On the other side of that coin, of course, the availability, and where and how do we make very sure we don't put all eggs in one basket and source from just one either partnership strategy or location or sourcing, but we look at that diversified approach and strategy that would have served us perhaps much better than we experienced during COVID. I think that cost tolerance item, Dimitri, that you identified I hear that a lot, but I go back to many health leaders that said, yes, we've saved all this money in Canada over the last number of years, and we just spent double that in the first few weeks of a pandemic. So the cost relative to the risks perhaps is something to take forward, and couldn't agree more that perhaps the silver lining of where we've been in this pandemic is the very bright, shiny light that we now have on what are those opportunities to drive and advance supply resilience in this country. As you've all pointed out, a number of them, and the action-oriented strategy, not just continuing to identify all the many challenges, but putting our pens down and sitting together to say, all right, what are the strategies, even if they are not perfect? There's always the double-edged sword, I think, as Dimitri pointed out so beautifully. But moving in the direction we need to, and we've absolutely seen that that's possible. You've said in the last 6 months, we've seen more progress in the last 10 years. I saw things in health systems across this country that I never thought I'd see that happened in a matter of a few weeks. So Canada and Canadians, especially the leaders at this table, absolutely have the capacity and expertise to do that. And again, can't thank you all enough for setting a very important stage of where those opportunities are. What we will do now is take a brief break and then come back at, I believe it is 1:30 for the work group panel. If I'm wrong, Catherine, by all means, jump in, and I think it's at 1:22. So we are just 8 minutes away. We're going to just take a break and come back, and we will be now continuing this very important dialogue with our work group leaders who have been working so closely with our partners in their respective areas to respond and to really explore where and how we take some of these ideas forward. So please come back and join us in just a few minutes. Thank you so much.
Thank you.